Hi, I'm Raffaele Corbisiero. I am the Chief of Electrophysiology at Deborah Heart and Lung Center. Electrophysiology is the study of the electrical system of the heart. So we deal with things like abnormal heart rhythms and people who might need devices like pacemakers and defibrillators. So the Department of Electrophysiology offers full service when it comes to any electrical problems with the heart. So one of the biggest things that we deal with in patients with sick hearts is the risk of congestive heart failure. Also with that comes with the problem of sudden cardiac arrest. Unfortunately, our patients are at risk of dying suddenly from abnormal heart rhythm problems, and we can prevent that with a special device called a defibrillator. And these two problems are actually combined since they occur together, and we actually have a device that can take care of both problems. It's called a biventricular defibrillator. In taking care of patients, I feel that being aggressive more early on is the best benefit for our patients. If there's an issue with heart function, and if it's low, we want to get to that patient early to try to help them and prevent any progression of that getting worse. The other big circumstance that we deal with is a rhythm problem called atrial fibrillation. This is the most common rhythm problem in the world. Almost 2% of the planet has it. And the thinking by some doctors is, well, it's not that bad, we'll treat it with medicines, we'll watch it, we'll treat it with medicines, and as time goes on, the heart gets used to atrial fibrillation and the patient's usually stuck with it. Our philosophy right now in 2018 is, once we see atrial fibrillation, let's be aggressive in going after it. Here at Deborah, we have a stereotaxis robotic ablation lab where a catheter is placed in the heart, and that catheter is extremely safe while it moves inside the heart because it's being moved by magnets and computers and not being pushed around by our hands. So the procedure has become much, much safer. And if the ablation is successful, the results are much, much better than medications, and the patient does better in the long run. Well, at Deborah, it's an excellent place because there's a complete team approach towards this. So not only do you have the expertise of our electrophysiologist, but we have a heart failure team, cardiology team, surgical team. So in many of our cases, we use a combined approach where we may use the surgeons to help us, we may use the heart failure doctors to help us, and it's all done as a team. This is not something that usually is at other institutions. Well, obviously I got into medicine because the ultimate goal, in our society is really to try to do something for other people. I think Einstein said, a life lived for others is the only life worth living. So I think medicine kind of embodies that in the best way that I felt when I was a young man. And electrophysiology, to be honest, when I was training, was the toughest specialty within cardiology. And so the beginning of it was really a challenge because it was the toughest thing to do. So I took it on as a challenge. As I got into electrophysiology, I really saw the benefit in helping our patients because it's one of the few things that we can do to actually cure some problems. So there are some rhythm disturbances that we can actually cure. Cure meaning it's gone. Our physicians are quite busy because, especially in electrophysiology, we are full service within this hospital. And what I mean by that is we run a pacer clinic, we run an electrophysiology clinic downstairs. We also have our laboratory services where we're pretty busy during the day, running anywhere between 8 and 12 cases a day. And we also have a floor service where we work with a physician taking care of our patients who are in the hospital. And we also have a consult service. So your day is extremely full. In terms of what I do when I'm not here, I spend a lot of time doing workout routines. I'm a runner, so I run anywhere from 5Ks to marathons. We've done a little Tough Mudder action. And then most recently, one of our challenges with this group is we decided to climb Mount Kilimanjaro, and we just did that last month. The views were spectacular. It was not a dangerous expedition because you can climb Mount Kilimanjaro without equipment. It's a walk. But still, certainly learned what it's like to be short of breath on top of a mountain.